Let me start off by asking how many of you have a friend or family member that has served in the military? Personally, I have two cousins who have served in Iraq and Afghanistan. I remembered that they were always so fun and talkative before they went away, but when they came back, I could tell that they had changed. They were quiet and seemed to be depressed most of the time, yet they were the lucky ones. Hundreds of more veterans come back home with severe psychological issues that result in broken homes, broken relationships, and broken lives. However, these heroes' conditions can be treated, and there are plenty of ways that people can help out. Veteran psychological disorders are a serious problem in today's military and require several types of therapies and treatments. Several types of disorders are prevalent among America's veterans, especially those coming back from the wars in Iraq and Afghanistan. The most common of these is post-traumatic stress disorder, or PTSD. According to Lutz Whitman, author of Sleep and Hypnosis, PTSD is an anxiety disorder that can occur after you have experienced a traumatic event. Symptoms of this disorder include re-experiencing the event, avoiding anything related to the event, and or difficulty sleeping. Other signs of PTSD include significant distress and the inability to carry on a regular lifestyle. Aaron Bagelman, a health analyst in the Department of Veteran Affairs, states that 29% of all soldiers coming back from Iraq and Afghanistan suffer from post-traumatic stress disorder. Another common psychological illness among these veterans is bipolar disorder. Bipolar disorder is a mood disorder that usually includes depressive and irritable behaviors. Bagelman states that about 1 out of every 5 soldiers has been diagnosed with this condition. As a result of these psychological disorders, hundreds of veterans suffer from broken homes and broken lives. Rates of divorce are high among the families of veterans, and these rates continue to rise. Veterans with psychological disorders are also at an increased risk of becoming homeless. Last but not least, soldiers who suffer from these disorders are more likely to commit suicide. According to Jeff Hargarden of the Center for Public Integrity, the annual suicide rate among veterans is about 30 for every 100,000 of the population, compared to a civilian rate of about 14 per 100,000. As it can be clearly seen, psychological disorders among our soldiers is becoming a more serious problem. However, there are several treatments and therapies to help veterans with these disorders. The Department of Veterans Affairs states that veterans new to VA healthcare receive a PTSD screening, which is repeated every year for the first 5 years. If he or she is diagnosed with PTSD, then the vet can receive treatment in the form of medication and or cognitive behavioral therapy, which is a kind of talk therapy. Troops suffering from bipolar disorder are also screened before receiving treatment and are given a diagnosis. Bipolar disorders are usually treated with psychosocial intervention and medication. VA healthcare also provides several suicide prevention services. These include the Veterans Crisis Line, an online chat service, and an online suicide prevention resource center. There are also several charitable organizations that help raise awareness and provide treatment for vets with psychological disorders. A few of these are the Real Warriors Campaign and the Wounded Warrior Project. According to Bobby O'Brien, a writer in the media organization Off the Base, both groups encourage veterans and their families to seek help by providing them professional mental health services and paying for some of the costs. These are just a few of the ways that our soldiers' mental disorders are being treated. There are also several ways how people can help veterans with disorders. According to O'Brien, connecting with self-help resources, apps, and videos is one way to help understand mental illnesses. Using today's technology is an effective way of raising awareness of psychological disorders. Also, being aware of clinics and medical facilities that provide help for trauma survivors is another way to lend a hand. People should also watch out for the signs of mental disorders among vets so they can be identified. Encouraging veterans with these illnesses to seek out professional assistance is probably one of the most important things anyone could do to help out. Many of our troops do not seek help even when they know there is something wrong with them. By encouraging them to get help, these veterans know that people care about them and are more likely to take action. These are just a few of the ways that everyday people can help our troubled soldiers. In conclusion, the mental illnesses of our soldiers are a severe problem in today's military and require different types of treatments. These brave men and women have lived and seen horrible experiences that we cannot even imagine. They will have to live with these memories for the rest of their lives. However, thanks to the services provided by the government, charities, and everyday people, these veterans can receive the help they need and have good lives. Now we can give back to those who sacrificed so much for our freedom.